my name is Cynthia Siegel, and I just have a question on rheumatoid arthritis. And let's say if you're on a medication like Methotrexate, and there has been obvious joint damage that already has occurred.
Yes.
Now you're saying that this joint damage could be reversed, and the joint could be healed if you get on the proper diets and foods and things that you've been talking about, and just speak about Methotrexate and that type of thing.
So Cynthia has two different questions. One is to speak about methotrexate and some of the other arthritis drugs, and then the other is if you already have joint damage, is it possible to heal that? So I'm going to take the last question first. The more damage you have to your joint, the harder it is to heal. So the first part of the book, Avoiding the War, what that's going to do, like avoiding the things that are triggering you, is it's going to stop the inflammation, so it's going to stop the ongoing damage. So it's still, it takes diligence and it takes knowledge. Knowledge is power. But once you stop the inflammation, usually the need for the arthritis drugs goes away totally, so you don't have all those negative side effects from those drugs. Then the next question is, can you heal that damage? Some joints are damaged pretty much beyond complete repair. You may get a little bit. The more cartilage you still have left, the easier it is to rebuild from that base. So a little bit of joint damage is, it may take a few years of taking supplements like chondroitin and glucosamine and MS, and being on a really good diet. So the arthritis diet, the healing diet, once you avoid all your problem foods, it's very similar to the anti-cancer diet. I just kind of call it the heal everything diet. So it's high in vegetables, low in fats and carbohydrates, has lots of nutrients. You're keeping your glycemic index pretty low so that you're not having big sugar spikes. And generally, when you have these other supportive nutrients that help heal arthritis, there'll be a slow healing. But you'll notice that not, like when you cut out the very last problem food, within a week, and it's like a miracle, but your joints aren't healed. The joint healing usually happens over months and years. And like I said, there's no guarantee that you'll get everything back. And moving your joints through their full range of motion every day, even if you only have a partial range, that's really important both for limiting the damage and healing. And it's because there's no active circulation in a joint. The only way it gets the bad stuff out, the things that's already metabolized or the things that are irritating it, and the way it gets good nutrition in is through motion. So it's really good, even for healthy people, to every day just take everything through their range of motion a few times a day. And what people with arthritis often do is they hurt so much that they just want to stay still all the time. And there have been studies that show that if you splint healthy college students' arms, within 6 months of not moving, you can, under a microscope, see the same kind of pathological changes in rheumatoid arthritis. So to be healthy, joints have to move. So, and with regard to the methotrexate, there are 4 different classes of arthritis drugs, and 2 of them actually make it harder to heal, and people are really surprised at which 2 they are because they're over the counter. So all the non-steroidal anti-inflammatory drugs, things like ibuprofen, Advil, aspirin, Aleve, all of those are non-steroidal anti-inflammatory drugs. There are also some prescription ones, and they make leaky gut syndrome worse, every single one of them. So they're calming your inflammation, but they're making the underlying problem worse. It's kind of a little bit like throwing kerosene on a fire to put it out. So a lot of times people won't have very bad arthritis when they start taking these drugs, and it's the drugs themselves that make the problem worse. The other class of drugs that's not such a good idea to take with arthritis are the analgesics, particularly Tylenol, also known as acetaminophen. And the reason why is that with acetaminophen, to metabolize it, the body, it ties up the body's sulfur metabolism. And to have healthy joints, you have to have those sulfur metabolizing drugs available to rebuild your cartilage. So if you've got damaged cartilage and you're taking a lot of Tylenol, you won't even be able to do the basic maintenance functions while that's in your bloodstream. So it's going to make it much harder to heal, and it's going to do nothing to stop the inflammation. It'll deaden the pain, but the inflammation and the damage will still be ongoing. The other class of drugs, and people sometimes get really mad when I recommend that this is a useful class of drugs to take, are the disease-modifying anti-rheumatic drugs. They're the most toxic, and people get really mad when I say take enough of them to totally knock out your inflammation. If you can get relief from them, do it, because the inflammation is what is causing the damage. And that class of drugs, and methotrexate is one of the milder, less toxic ones in that. If you can get relief taking that, it's buying you time. It's never going to cure your arthritis, but if it buys you a year or two to work out your diet and heal your gut, methotrexate doesn't do anything that I'm aware of to mess up your gut. And it's going to make your life much calmer. And when you get rid of that last trigger food or chemical, you're not going to need it anymore.
What is that again?
Methotrexate is one of the drugs, the disease-modifying anti-rheumatic drugs. They're called DMARDs. D as in Delta, that's for disease. M as in, I don't know, anybody know the international code? That's modifying. Anti-A, rheumatic R, drugs D, DMARDs. Yeah, so that includes the biologics like Humira, that includes gold shots, that includes Plaquenil. There are like probably 30 or 40 different drugs in that class. And then the final class of drugs are the corticosteroids. And prednisone is one that's frequently injected into joints. And that's a miracle feel-good drug. So if you get that injected for a week or a month or maybe six weeks, you'll feel like you have no arthritis and you're on the top of the world. But the problem with that is it leaches calcium out of the joints, especially when you're weakening your joint. You're weakening the very structure of your joint, so it makes it harder ultimately to heal. And sometimes it's given orally, and it's very, very hard to get off because your adrenal glands shut down partially when you're taking that, and it's very hard to get them to come back up to full function. So it's a godsend for some people because the ongoing damage is worse. But what your son's taking is actually the very best thing if he wants to actually heal right now.
What are your thoughts on infusions that people with arthritis take, like Remicade or something like that?
I think that if they work well for you, they're buying you time. And so they're very compatible with what's in my book. Like if you can not be in inflammation and you can be comfortable, I would keep taking that for as long as you needed to, but it's never going to heal the underlying causes of your arthritis. It's just symptomatic control. The problem with something like Humira or Remicade is that usually they only last for a few years and then they stop working. So
I've been on it for 10 years.
Fantastic. A few people, that's true. So if that's going to work the rest of your life, you don't necessarily have to go through the hassle of healing your digestive system. I think that's great. This is for the rest of us who drugs weren't working for, or, I wish that drugs worked for everyone, but they don't. If you want to try this, you'll probably feel an increase in your health anyway, because one of the side effects of Remicade is you've got an immune suppression going on. Maybe that's not been a problem for you. Okay, great.